NHA Medical Assistant Exam questions. Question 1. When a minor surgical visit is added to the schedule, why should the assistant allow setup and cleanup time for procedures? Option A. Creates a fair method for filling cancellations. Option B. Prevents the room and team from being overbooked. Option C. Prevents avoidable access and payment problems. Option D. Reduces patient inconvenience and preserves continuity. The correct answer is option B. Prevents the room and team from being overbooked. Allow setup and cleanup time for procedures. This prevents the room and team from being overbooked. Offering the waitlist when an earlier opening is requested creates a fair method for filling cancellations, while verifying insurance requirements before scheduling a referral prevents avoidable access and payment problems. Rescheduling promptly when the provider becomes unavailable reduces patient inconvenience and preserves continuity. Question 2. Why is recognizing the PR interval as atrioventricular conduction time appropriate when the assistant measures from the start of P to the start of QRS? Option A. Creates a small contact area while limiting unnecessary skin irritation. Option B. Improves cooperation while maintaining dignity during chest exposure. Option C. Reduces somatic tremor artifact from skeletal muscle activity. Option D. Evaluates conduction from atrial depolarization through the AV system. The correct answer is option D. Evaluates conduction from atrial depolarization through the AV system. Recognize the PR interval as atrioventricular conduction time. This evaluates conduction from atrial depolarization through the AV system. Clipping excessive hair rather than shaving broadly creates a small contact area while limiting unnecessary skin irritation. While explaining the procedure and preserve privacy improves cooperation while maintaining dignity during chest exposure. Asking the patient to remain still and quiet reduces somatic tremor artifact from skeletal muscle activity. Question 3. Which outcome supports securing loose electrodes and lead wires when the tracing develops intermittent breaks and wandering deflections? Option A. Improves cooperation while maintaining dignity during chest exposure. Option B. Creates a small contact area while limiting unnecessary skin irritation. Option C. Restores consistent electrical contact. Option D. Prioritizes clinical assessment rather than independent interpretation. The correct answer is option C. Restores consistent electrical contact. Secure loose electrodes and lead wires. This restores consistent electrical contact. Explaining the procedure and preserve privacy improves cooperation while maintaining dignity during chest exposure. While clipping excessive hair rather than shaving broadly creates a small contact area while limiting unnecessary skin irritation. Notifying the provider promptly of concerning symptoms or tracing changes prioritizes clinical assessment rather than independent interpretation. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. What is the main reason to use the fine adjustment at high power when the specimen is viewed with a high power objective? Option A. Refines focus without the large movement produced by the coarse control. Option B. Identifies red cell rupture that can alter multiple analytes. Option C. Prevents vibration, equipment damage, and incomplete separation. Option D. Prevents false interpretation from reading too early or too late. The correct answer is option A. Refines focus without the large movement produced by the coarse control. Using the fine adjustment at high power refines focus without the large movement produced by the coarse control. Inspecting a specimen for hemolysis identifies red cell rupture that can alter multiple analytes, while balancing centrifuge tubes by mass and position prevents vibration, equipment damage, and incomplete separation. Following the exact timing specified by the test procedure prevents false interpretation from reading too early or too late. Question 5. How does maintaining an inventory par level help when frequently used clinical supplies are being reordered? Option A. Uses data to identify causes and improve processes. Option B. Supports timely review and correct filing. Option C. Reduces shortages while avoiding unnecessary overstock and expiration. Option D. Provides evidence of safety and compliance. The correct answer is option C. Reduces shortages while avoiding unnecessary overstock and expiration. Maintaining an inventory par level reduces shortages while avoiding unnecessary overstock and expiration. Participating in quality minus improvement tracking uses data to identify causes and improve processes, while date minus stamping supports timely review and correct filing. Documenting equipment inspections and maintenance provides evidence of safety and compliance. Question 6. Which safety or quality benefit comes from passing instruments with the working end controlled when the provider requests a sharp instrument? Option A. Protects team members and presents the handle safely. Option B. Securely controls the curved needle during suturing. Option C. Applies pressure to vessels or tissue for hemostasis. Option D. Reduces hand minus to minus hand sharps injuries. The correct answer is option A. Protects team members and presents the handle safely. Pass instruments with the working end controlled. This protects team members and presents the handle safely. Recognizing a needle holder as the instrument for driving a suture needle securely controls the curved needle during suturing, while recognizing a hemostat as a clamping instrument applies pressure to vessels or tissue for hemostasis. Placing used sharps in a designated neutral zone when used by the team reduces hand minus to minus hand sharps injuries. Question 7. Which option accurately defines supine in the area of medical terminology? Option A. Located farther from the point of attachment or origin. Option B. Lying flat on the back with the face upward. Option C. Abnormal accumulation of fluid in tissues. Option D. A blood glucose below the expected range. The correct answer is option B. Lying flat on the back with the face upward. Supine describes lying flat on the back with the face upward. It is a common position for abdominal and anterior examinations. Distal describes located farther from the point of attachment or origin. Edema describes abnormal accumulation of fluid in tissues. Hypoglycemia describes blood glucose below the expected range. Question 8. After recognizing that the assistant wants the patient's full description of the problem, why should the assistant use an open-ended question to begin the interview? Option A. Encourages a narrative rather than a one-word answer. Option B. Preserves a professional relationship and privacy. Option C. Reduces fear without giving misleading reassurance. Option D. Reveals misunderstandings and supports safe follow-through. The correct answer is option A. Encourages a narrative rather than a one-word answer. Use an open-ended question to begin the interview. This encourages a narrative rather than a one-word answer. Maintaining therapeutic boundaries preserves a professional relationship and privacy. Speaking to a child at an age-appropriate level reduces fear without giving misleading reassurance. And confirming understanding by asking the patient to explain the plan reveals misunderstandings and supports safe follow-through. Are you looking for NHA Medical Assistant Exam actual questions? Visit our website pokerexams.com to access NHA Medical Assistant Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get NHA Medical Assistant Exam answer key today. Question 9. During billing and coding basics review, the assistant encounters code specificity. What does this term mean? Option A. Classification of unpaid balances by how long they have been outstanding. Option B. The process of recording billable services and supplies. Option C. A payer check comparing a service with the reported diagnosis. Option D. Selection of the most detailed supported diagnosis code. The correct answer is option D. Selection of the most detailed supported diagnosis code. Code specificity means selection of the most detailed supported diagnosis code. It uses available details such as site, laterality, and encounter information. Accounts receivable aging means classification of unpaid balances by how long they have been outstanding. Charge capture means the process of recording billable services and supplies. Medical necessity edit means a payer check comparing a service with the reported diagnosis. Question 10. Which result is expected from prioritizing an urgent referral over routine scheduling when the provider identifies a potentially serious new finding? Option A. Reduces delay when rapid specialty assessment is needed. Option B. Ensures timely clinical action and documented communication. Option C, improves accurate communication across settings. Option D, closes the communication loop and reduces loss of time minus sensitive data. The correct answer is option A, reduces delay when rapid specialty assessment is needed. Prioritizing an urgent referral over routine scheduling reduces delay when rapid specialty assessment is needed. Escalating an abnormal result ensures timely clinical action and documented communication. Arranging a qualified interpreter for coordinated services improves accurate communication across settings, and confirming receipt of critical information by the receiving party closes the communication loop and reduces loss of time minus sensitive data. Question 11. When a new testing run is being prepared, why should the assistant check reagent expiration dates before use? Option A, identifies bilirubin-related discoloration that may affect interpretation or testing. Option B, verifies that the system is performing within acceptable limits. Option C, distinguishes plasma containing clotting factors from serum after clotting. Option D, prevents use of materials with uncertain performance. The correct answer is option D, prevents use of materials with uncertain performance. Checking reagent expiration dates before use prevents use of materials with uncertain performance. Inspecting a specimen for icterus identifies bilirubin-related discoloration that may affect interpretation or testing. Running required quality controls before reporting patient results verifies that the system is performing within acceptable limits, and recognizing plasma as the liquid from anticoagulated blood distinguishes plasma containing clotting factors from serum after clotting. Question 12. Why is measuring intake and output accurately appropriate when the provider requests fluid-balance monitoring? Option A, provides objective information about hydration and renal function. Option B, exposes posterior structures with the patient facing downward. Option C, verifies the correct patient, procedure, site, and necessary information. Option D, estimates expiratory flow and helps monitor airway narrowing. The correct answer is option A, provides objective information about hydration and renal function. Measure intake and output accurately. This provides objective information about hydration and renal function. Using the prone position for a posterior body examination exposes posterior structures with the patient facing downward, while performing a procedural time-out verifies the correct patient, procedure, site, and necessary information. Using a peak flow meter estimates expiratory flow and helps monitor airway narrowing. Question 13. Which outcome supports asking protocol-based urgency questions without diagnosing when a patient requests an appointment for worsening symptoms? Option A, gathers information needed for approved triage or escalation. Option B, prevents conflicts with workflow and procedure needs. Option C, builds a recovery period into the schedule. Option D, prevents avoidable access and payment problems. The correct answer is option A, gathers information needed for approved triage or escalation. Asking protocol-based urgency questions without diagnosing gathers information needed for approved triage or escalation. Following provider-specific scheduling preferences prevents conflicts with workflow and procedure needs. Using modified-wave scheduling when brief catch-up time is needed builds a recovery period into the schedule, and verifying insurance requirements before scheduling a referral prevents avoidable access and payment problems. Question 14. What is the main reason to follow through on promised contact when the assistant agrees to call after checking an authorization? Option A, turns feedback into a targeted process change. Option B, provides consistent information without arguing. Option C, builds reliability and prevents repeated patient effort. Option D, gets the issue to someone able to decide. The correct answer is option C, builds reliability and prevents repeated patient effort. Following through on promised contact builds reliability and prevents repeated patient effort. Reviewing satisfaction trends for improvement turns feedback into a targeted process change, while explaining office policy clearly and respectfully provides consistent information without arguing. Escalating unresolved complaints through the chain of command gets the issue to someone able to decide. Question 15. How does administering medication only with a valid order and permitted supervision help when an injection is listed in the treatment plan? Option A, uses the amendment or clarification process rather than editing another author's entry. Option B, recognizes that permitted functions vary by location and setting. Option C, reinforces instructions without creating an independent treatment plan. Option D, keeps medication activity within delegated authority. The correct answer is option D, keeps medication activity within delegated authority. Administer medication only with a valid order and permitted supervision. This keeps medication activity within delegated authority. Not altering a provider's documentation uses the amendment or clarification process rather than editing another author's entry, while following state law and employer policy when duties differ recognizes that permitted functions vary by location and setting. Providing education from an approved care plan reinforces instructions without creating an independent treatment plan. Question 16. Which safety or quality benefit comes from recognizing a hemostat as a clamping instrument when a small bleeding vessel must be controlled? Option A, applies pressure to vessels or tissue for hemostasis. Option B, preserves specimen identity before it leaves the room. Option C, holds tissue aside to improve visualization. Option D, protects team members and presents the handle safely. The correct answer is option A, applies pressure to vessels or tissue for hemostasis. Recognizing a hemostat as a clamping instrument applies pressure to vessels or tissue for hemostasis. Labeling a biopsy specimen in the patient's presence preserves specimen identity before it leaves the room. Recognizing a retractor as an exposing instrument holds tissue aside to improve visualization, and passing instruments with the working end controlled protects team members and presents the handle safely. Question 17. The provider documents apnea during a medical terminology review. Which description should the assistant recognize? Option A, vomiting of blood. Option B, a temporary absence of breathing. Option C, bluish discoloration of the skin or mucous membranes. Option D, positioned on one side of the body. The correct answer is option B, a temporary absence of breathing. Apnea means a temporary absence of breathing. It identifies cessation of respirations rather than merely slow breathing. Hematmesis means vomiting of blood. Cyanosis means bluish discoloration of the skin or mucous membranes. Lateral means positioned on one side of the body. Question 18. AHIPAA Privacy and Security Review uses the term public health disclosure. Which description is accurate? Option A, destruction that makes protected information unreadable and unrecoverable. Option B, a permitted disclosure to authorized public health entities under applicable conditions. Option C, a person or organization performing certain functions involving protected information for a covered entity. Option D, information released when a law requires reporting such as certain abuse cases. The correct answer is option B, a permitted disclosure to authorized public health entities under applicable conditions. Public health disclosure means a permitted disclosure to authorized public health entities under applicable conditions. It supports activities such as disease reporting without routine authorization. Secure disposal means destruction that makes protected information unreadable and unrecoverable. Business associate means a person or organization performing certain functions involving protected information for a covered entity. Mandatory reporting disclosure means information released when a law requires reporting such as certain abuse cases.
Stressed about your NHA CCMA exam? We can take NHA CCMA exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. How should sinoatrial node be understood when studying anatomy and physiology? Option A, the selectively permeable boundary surrounding a cell. Option B, the microscopic air sacs at the ends of bronchioles. Option C, the organ system primarily responsible for gas exchange. Option D, the cardiac structure that normally initiates each heartbeat. The correct answer is option D, the cardiac structure that normally initiates each heartbeat. Sinoatrial node describes the cardiac structure that normally initiates each heartbeat. It functions as the heart's natural pacemaker. Cell membrane describes the selectively permeable boundary surrounding a cell. Alveoli describes the microscopic air sacs at the ends of bronchioles. Respiratory system describes the organ system primarily responsible for gas exchange. Question 20. Which result is expected from draping the patient to expose only the area being examined when the provider begins an abdominal examination? Option A. Exposes posterior structures with the patient facing downward. Option B. Ensures supplies, equipment, cleanliness, and safety are ready before care begins. Option C. Reduces falls and musculoskeletal injury. Option D. Protects dignity while allowing adequate access. The correct answer is option D. Protects dignity while allowing adequate access. Drape the patient to expose only the area being examined. This protects dignity while allowing adequate access. Using the prone position for a posterior body examination exposes posterior structures with the patient facing downward. Preparing the examination room before seating the patient ensures supplies, equipment, cleanliness, and safety are ready before care begins, and using body mechanics and assistance for transfers reduces falls and musculoskeletal injury. Question 21. A medical law and ethics study note highlights justice. Which definition matches? Option A. Professional negligence by a healthcare practitioner. Option B. The ethical principle of fairness. Option C. A false defamatory statement spoken to another person. Option D. The ethical duty to communicate truthfully. The correct answer is option B. The ethical principle of fairness. Justice means the ethical principle of fairness. It supports equitable treatment and allocation without improper discrimination. Malpractice means professional negligence by a healthcare practitioner. Slander means a false defamatory statement spoken to another person. Veracity means the ethical duty to communicate truthfully. Question 22. Why is using the ordered solution such as sterile normal saline appropriate when the wound requires routine irrigation? Option A. Cleans effectively while limiting tissue trauma and splash. Option B. Reduces tension on the abdominal incision. Option C. Avoids tissue-damaging products unless specifically prescribed. Option D. Provides information about amount, color, odor, and change over time. The correct answer is option C. Avoids tissue-damaging products unless specifically prescribed. Use the ordered solution such as sterile normal saline. It avoids tissue-damaging products unless specifically prescribed. Irrigating with controlled pressure cleans effectively while limiting tissue trauma and splash, while positioning an evisceration patient with knees flexed if tolerated reduces tension on the abdominal incision. Observing drainage on the old dressing provides information about amount, color, odor, and change over time. Question 23. Which outcome supports documenting clinically relevant communication objectively when a patient refuses an important recommendation? Option A. Identifies possible mismatch between words and comprehension. Option B. Demonstrates listening and invites further clarification. Option C. Records facts, education, response, and notifications without judgment. Option D. Reduces fear without giving misleading reassurance. The correct answer is option C. Records facts, education, response, and notifications without judgment. Document clinically relevant communication objectively. It records facts, education, response, and notifications without judgment. Observing nonverbal cues identifies possible mismatch between words and comprehension. Reflecting the patient's statement demonstrates listening and invites further clarification. And speaking to a child at an age-appropriate level reduces fear without giving misleading reassurance. Question 24. What is the main reason to insert a subcutaneous needle at a 45- or 90- angle as appropriate when medication is ordered for the fatty tissue layer? Option A. Improves delivery to the intended tissue layer. Option B. Matches the angle to needle length and the patient's tissue depth. Option C. Reaches the muscle through skin and subcutaneous tissue. Option D. Isolates the sharp and reduces accidental exposure. The correct answer is option B. Matches the angle to needle length and the patient's tissue depth. Inserting a subcutaneous needle at a 45- or 90- degree angle as appropriate matches the angle to needle length and the patient's tissue depth. Selecting needle length based on route, site, and tissue depth improves delivery to the intended tissue layer. Inserting an intramuscular needle at a 90- degree angle reaches the muscle through skin and subcutaneous tissue, and activating the safety device immediately after injection isolates the sharp and reduces accidental exposure. Question 25. A record related to billing and coding basics includes CPT. Which interpretation is appropriate? Option A. The encounter form listing common diagnoses, procedures, and charges. Option B. The code set used to report diagnoses and health conditions in outpatient care. Option C. The code set used to report physician services and procedures. Option D. The Medicare notice used before a service expected to be denied is not reasonable and necessary. The correct answer is option C. The code set used to report physician services and procedures. CPT is the code set used to report physician services and procedures. It describes professional work performed during the encounter. Superbill is the encounter form listing common diagnoses, procedures, and charges, while ICD-10-CM is the code set used to report diagnoses and health conditions in outpatient care, and advance beneficiary notice is the Medicare notice used before a service expected to be denied is not reasonable and necessary.